it's Dr. Campano. Welcome to my virtual experience for Ellacor. What you're going to learn today is how Ellacor can help your face, your neck, and other parts of the body, and to see if you're a candidate. Please stay tuned for the whole webinar so that at the end we're going to have a live Q&A. So if you have any questions, just type that in and I will answer for you live. And don't forget, we're going to be giving away some raffles for Diamond Glow procedures. So today I'm going to be talking about Ellacor. Ellacor is a unique, really amazing treatment. There's nothing else like it. So what it does is it cores tissue out. So you're actually removing tissue. And what happens when you remove tissue in between this area of skin? It's going to heal like this. It's going to come together. You're automatically going to get skin tightening. With some of the other treatments that I have and what other people have is that you kind of hope that putting some kind of heat or radio frequency, you get that skin to tighten. With this one, we already know, like when you go to the dermatologist, if you've ever had a punch biopsy done, they core some tissue out and take it out. So the really smart people from the Ellacor company, and it's Harvard trained people, basically said, hey, they were dermatologists who created this, if we can take out a punch and that skin is going to come together, we're going to get skin tightening. So what they did is they figured out how to make that so thin so that you don't get scarring, but large enough so that you get tissue tightening. And they've tried for years, they've trained, they've done everything on little piggies all the way up to humans, and then now we reap the benefits from it. So patients have asked me, should I do this instead of a CO2 laser? So a fractional CO2 laser, or when I trained, it was the old-fashioned CO2 lasers. You're going to ablate your skin, and then with a fractional 3, 5, 7, 14 days later, you'll have beautiful skin. With the old-fashioned, it was up to a month of downtime. And it does different things. So if you think of a CO2 laser, you're ablating the skin. So your skin's going to have a great quality, and you will get some tissue tightening, and you will get improvement in fine lines and things like that. But this treatment goes even deeper. You're going to go down and core out the tissue so you can get to above the fat level. So you're actually going to remove all of that, and then it's going to heal and tighten. So you're going to get a through and through skin change. I think especially for the areas that the laser doesn't quite address in this area, because when you look at the smoker's lines, for people who don't even smoke, it's very frustrating. And so you laser the skin, but the deep tissue also has that problem. So with this one, you're actually coring out and removing deep tissue and allowing that area to heal. So essentially, this can be used for skin types 1 through 4. Some are people doing it on people of 5 and 6. In my practice, I think that right now, we're going to pretty much stick to Caucasian patients. Those are the patients who come in, complain of skin laxity. They may not want to have a facelift just yet. If you come into the office, people who know me know I'm pretty blunt. I'll tell you, if your tissue is hanging off your jaw, really you need a facelift. Some people aren't medically capable of having surgery, or it's beyond their financial capabilities. So then there's other treatments that we can do. And some of them give you some skin tightening, but nothing is like this procedure that will actually remove skin. You can remove up to 7% of your skin with each treatment, which to me is pretty fabulous. So as a facial plastic surgeon, when I do a facelift, I'm going to lift up the tissue. I do a deep plane facelift, which basically all this tissue I lift up, and then I lay the skin over and remove the excess skin. So with this treatment, right into the areas here, you're going to remove excess skin, and what's it going to do? It's going to tighten. So essentially the downtime is about a week. So those of you who have had a CO2 laser with me know that the downtime's, about 7 to 10 days, but you're going to have redness for a couple of months. With this treatment, it's actually, I'm surprised how little downtime there actually is. So I'd say give it about a week and you'll get a great result. People also ask me, how long will it last? It will be perfect if you didn't age, but we do tend to age. For the CO2 lasers, I usually do another treatment about every 5 years or so. and it's individual. In between, there's other things we can do to help non-ablatively help to tighten up your skin and keep you firm. But with this laser, I would probably say that you need 1 or 2 treatments, just depending on your decade of age. Hello. All right, so let's take a look at your picture. And what brings you in today?
Well, I was hoping to get something that would help me be a little younger, a little more vibrant looking in the face.
Okay, sounds good. What kind of treatments have you had before?
I had Thermage about a year ago.
Okay.
And that seemed to be nice, but I think over a year when it faded away, I also got older. I can't imagine that happening.
That's terrible,
but, you
right?
know,
All right. So when we look at your face, there is kind of a descent of tissue. There's some jowling. So essentially, when we look at your tissue, when the jowl hangs down like this,
yes,
I usually do recommend at this point a surgical intervention. If you're not interested in surgical intervention, because it doesn't sound like you are, then the next step would be other possibilities. So, but nothing we do is really a surgical intervention. Surgery is surgery. So when this goes down, I would say a facelift and the neck at the same time. So face and neck lift. But there are things that we can do to improve this. So when this descends, what we can do is something called Ellacor. Have you heard of that?
no, I haven't heard of that.
Okay. So basically, Ellacor is a treatment where I'm removing tissue. So like in surgery, I'm going to lift up the skin. I'll take that deep tissue, lift it up. It's called a deep plane facelift. And then I put the skin back over and remove the excess skin. In this procedure, so all of the other procedures were doing something to the surface of the skin. Then there's some things with microneedling where you're going down, but you're not removing tissue. With this, you're actually coring out tissue. So if you think of a dermatologist, if you've had a punch biopsy at the dermatologist, you're going to remove that tissue. It's coming out. And then when you have literally what's left, skin and skin, it comes together. Because that's how you heal, is it comes together. So really smart people at Harvard
Very
figured
interesting.
it out.
Very interesting.
It's amazing because there's really nothing like this. It's, to me, like a revolutionary kind of treatment, and it's very effective. So thank you so much for attending this virtual lecture. Don't forget, our giveaway winners will be notified by email for the Diamond Glow. And also go ahead and check your text after this event and reply back so you can book a consultation with me in the office. And then for the next 15-20 minutes, go ahead and type any questions that you have and chat with me. Hi, it's Dr. Campano. Thank you so much for joining us for my virtual event, my first virtual one. I feel so modern. So if anybody has any questions, just go ahead and put it into the question box and I'll answer them for you live. And don't forget that we are giving away Diamond Glows. So we're giving away 4 free Diamond Glows. So we will get a list of all of the attendees and raffle that off for you, and we'll contact you directly. Also, we'll be contacting you if you say it's okay, if you would like a consultation with me to evaluate you for the treatment. So I'm getting some questions here. Someone asked me about bruising. So the bruising, a bruise takes about, I'd say, about 2 weeks for an evolution of a bruise. So you're going to have, if you think about just a Botox needle, you'll have a bruise potentially from that needle. These are a whole bunch of little needles, but overall, I've seen patients who I have known to bruise, and it's their standard, 1 to 2 weeks of bruising time. This doesn't change it. The actual evolution of that hemoglobin underneath the skin, changing color as it breaks down, that's not going to change. Why do I like Ellacor so much? So essentially, I think it's such a novel treatment because I only had fillers or surgery, such as a face and neck lift. And with this, or lasers for the superficial aspect of the skin. There's microneedling where you put little needles in, you kind of hope this tissue tightens, and sometimes it does and sometimes it doesn't. So with this one, I know for a fact if there is a core of tissue removed, that tissue is not going to stay open. It's going to heal. So it's a really great, almost like a surgical type procedure but minimally invasive. So come in regarding the pricing. It's about the cost of a CO2 laser. And it also depends on you, your quality of your skin, the descent of your aging, and how many treatments you'll need. Each treatment takes me about 30 to 40 minutes to do the procedure, and it takes me about 20 minutes or so to numb you up. So full time, about an hour for the procedure, and then you come in and we put a topical numbing. I actually have a pretty detailed anesthesia protocol that I've developed that my patient, when I did the procedure on her this morning, I asked her, what is your pain threshold? She said 0 out of 10 pain after it's kind of like dental anesthesias that I'm doing for patients. And then so pain level while the procedure is done. Once the actual numbing is done, my patient today said she had 0 pain. Everybody is different, obviously, but I try to get you as comfortable as possible. So when we talk about where is it going to be performed in the face, we're doing it basically what a facelift would do. So we're putting it into, one sec. We're putting it from here all the way to here, and then the neck. So I think the most important area for a lot of people is right here. And then also kind of the smoker's line. Even if you're not a smoker, we get this line that's quite deep. And with the laser, I can get the surface of it and the lines going deeper and deeper. So sometimes I put fillers in those lines, and it's complicated with this procedure. When you're going through and through and you're removing that, it's amazing that you can get that result. And so someone asked me, how do you know if you're beyond Ellacor and you need a facelift? Coming for me for a consultation, like I told you, I'm pretty honest with my patients. I will tell you, hey, you're a candidate for this procedure, or, what would work really a lot better would be a face and neck lift. And it depends on someone's, ability to have a facelift, your medical condition. Some people are not surgical candidates. So we can just have a discussion based on our consultation about your expectations. I always want people to have really clear expectations of any procedure. I think you can go to some place and they'll say, oh, it's the non-surgical facelift. Everything is a non-surgical facelift. A facelift is a facelift. There's nothing that can replace it. But this is a very impressive, minimally invasive. It's almost surgical, but it's not a scalpel surgical. So we're removing tissue and we're tightening skin. And then the next procedure question is, can I apply sunscreen or makeup after the treatment? So usually we have you after the procedure. I like to use a product called Nectar, which is from the Elastin line. It helps you to heal. We put the Nectar on you, and then we have you use Aquaphor, which is like a Vaseline petroleum jelly. It's a skin protectant. So you can use that for a few days, or you can use, we have skin protecting kind of creams for you to use for the procedure. And that helps you heal. And I would say heal time is about a week. So your skin is actually closed within about 24 hours. But I think as far as redness, swelling, bruising, I'd say it's about a week for most of my patients. I have patients come in at day 1. I have you come back in 1 week, and then at 2 weeks. And so by 2 weeks, I don't see any bruising so far on the patients. There's going to be exceptions. Some patients are on some blood thinners. We have you stop the blood thinner for the procedure, and then you can start up again the day after the procedure. But except for those patients, most people really don't have too much bruising or swelling versus some of the other procedures that I do for patients. Okay. And so it says, when can I apply sunscreen? You can just apply it the next day. I don't go to the area around the eyes. The reason is the depth of the needle. So we want to protect the tissue right under the eyes is just above the bone. I think that in the future, they'll probably develop handpieces with more shallow type needles. But right now it is not safe. And I hope no one is doing procedures right under the eyes. I know they are because I've seen it in the posting of this and that, but it's at this point not safe to go under the eyes. So you are completely awake for this procedure. Someone asked, can this be done with a local anesthetic? absolutely local anesthetic. So for some of my other more painful procedures, I have a nice little happy cocktail, my little happy juice, where I have you take a relaxing medicine, a pain medicine, anti-nausea, just in case. For this procedure, there is no pills. People don't need the pills. They come in. I do essentially, if you can go to the dentist and get nerve blocks, I do nerve blocks in this central area. Then I administer some numbing medicine here. We buffer the lidocaine with bicarbonate to make it more comfortable. And then in the neck area, I actually use, it's called tumescent fluid. So when I do liposuction, it's a different kind of fluid. So it's you can administer more volume in a but smaller amount of lidocaine. It numbs people up. Again, my patients say it's very comfortable after the numbing. Obviously, the numbing is a needle, but that's straight local anesthetic that I'm using. Oh, thank you. Someone said I look young. I appreciate that. How far are you booking at the moment? I'm not sure. Just give us a call at 661-726-6277, and then you can just make an appointment with me. And do fillers interfere with the procedure? So because we're removing tissue, I would say that if you've had a facial filler within the last 2 months of this procedure, that we would wait to do it a little later. However, except for Sculptra, in this area, we really don't do too many facial fillers. You know, I do voluma and some in the contours up here on the bone, but in this area, not too many. Now, and then there's the labial folds. Obviously, there is a little filler. So if you do have that, I would wait a few months. And again, you come in, we'll evaluate you. When patients come to see me, it's not just usually, hi, I need a filler right here, or I need this. I like to examine you. You saw in the consultation, we take pictures of your face and we examine your face. You tell me, your lifestyle, what's available to you. I have a lot of patients in Acton. They're very active in the horse community, and they don't have time for downtime. They're outside every single day. They have to be in the sun. So it just depends on you, your lifestyle. I customize it for you and what your expectations are. Another filler question, same thing. The procedure, again, takes about an hour. And someone said, it sounds like a great new treatment. They're interested. I'd like you to be off of aspirin for 2 weeks before the procedure. But if you are on other blood thinners like Eliquis or Pradaxa, I just take the recommendation of your cardiologist or your primary. And that's usually, they're only off of it for 2 days before the procedure. And you start 1 day after the procedure is over, because basically your skin is healed within 24 hours. So you won't have any further problems. So as a reminder, you'll be receiving a text message, and please reply with the code word RENEW to be contacted for a consultation. The procedure is, someone asked, where is it going to be performed? It's done right here in the office. As you know, we do a lot of procedures in the office, like the smart liposuction, the CO2 laser, but this procedure is done in my procedure room in the office. So you don't have to go to a surgery center or anything. We are performing the procedure in the Valencia office as well. So someone asked a question, how many treatments do you need to get? Well, you should kind of say, if you're in your 50s, you probably need one treatment, 40s, 50s, one treatment, 60s, two treatments, 70s, maybe three treatments, but everyone's individual. So I did a procedure where just injecting the numbing medicine for this patient, she was so tight from other treatments that we've done, like the CO2 and other procedures. So she only needs one. But other people are, everybody's variable. Again, come in, I will give you a customized consultation, and we'll think of a treatment plan, go through everything that you feel needs to be addressed, and then we'll try to figure out a way to accommodate you and do whatever you need. A question again in the location, so it's in the office. The normal downtime is 1 week. And, there's been different, when you look, there's different doctors who do different procedures. There's different nurses who do different procedures. Everyone's got their own way to do procedures. I think that if you have a really good patient selection, so, I'm going to be very circumspect in what patients I think are good candidates. So if you're a good candidate, then I'd say probably your downtime's about a week. And again, I see my patients back at several intervals. So I see exactly what's going to be your individual. Bruising might be 2 weeks, but your skin is completely healed. You can put makeup back on, all of that within a week on average. Oh, one of my patients, thank you. She said, not a question, just a compliment. She loves that you always try to help your patients with the most minimally invasive procedures necessary to achieve an improvement. Thank you. Thank you for thanking me. I appreciate that. What are some good things to do before to help speed up the healing process? So this would not be a time for you to diet. I like people to eat, good proteins, be really healthy, that kind of thing. Avoid sun, because any kind of cut on your skin, any kind of laser on your skin makes you more sensitive to the sun. So just in general, I'm always someone who has a wide brim hat, has my sunscreen. I reapply my sunscreen very religiously. That's what I think is really important to do. And that's what I would say. Just take really good care of your skin, and that will help you be a good candidate for any procedure and heal up your healing process. There are some patients who have healing problems. They have autoimmune diseases and other things. And I usually recommend taking maybe something like Juven, Juven. It's made by those protein supplement companies, and that's something that can speed up healing. But I think if you just have a healthy lifestyle, you are a healthy person, you will most likely heal very well. And how do I do that? I do the neck, and it's just the same way. You use the handpiece, and it's almost like a sewing machine. It's like little needles, boom, 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 goes through. They're hollow needles, so that the hollowness removes the core of tissue, and there's a vacuum, so the tissue core is suctioned up, and then we wipe it away. So same thing with the neck. So the neck skin is very thin. So that's why I use something called tumescent anesthesia. So the lidocaine is not just straight lidocaine. I use the same thing that I use with liposuction, which is called Klein solution. It's tumescent anesthesia. And so that gives you a little bit of cushion because there's a little bit more fluid in the neck, and do the procedure. And one of the questions is, do I recommend Ellacor to men? Absolutely. Men have descent of tissue. Men want to look good as well. I've had wives bring their husbands to me saying, I want him to look as good as I do right now because they've been seeing me for years. So absolutely, men are candidates. And if we're removing tissue, it's not going to really even remove a whole beard. So I haven't seen anybody have problems with poor beard healing. Are there any restrictions on flying following the procedure? There are no restrictions on pretty much anything following the procedure except sun exposure in general. I want everyone to restrict their activities just so they heal better. You can go flying, but I would like you to have basically the healing. You can have the procedure theoretically and just go do whatever you want. I like to see my patients back. And if you don't have the ability to come back, I totally understand, because some patients are flying in from Texas, they're driving in from Vegas or flying in to have the procedure done. So we can do a Zoom. It's a DoxyMed program, so I can check on you. But there's no restriction to flying. It's just basically if you have like a cut on your hand or your face or your knee, that's how it heals. Like a scratch. So there's no restrictions on flying for that. How soon after the procedure can I start working out at the gym? I would like you to wait about a week, only because I don't want you to perspire and get an area dirty. I don't prescribe any antibiotics or anything to prevent an infection, but I would like you to prevent an infection by just being clean. I think that when we exercise, we tend to perspire, and you could potentially get a skin infection from that. And then, yes, a question was, do we do PRP in combination with the treatment? Absolutely. So your skin is open when I'm removing that tissue. So it's not just like a little microneedling micropores opening. We're actually creating a large enough channel that anything we apply, so we can apply exosomes, we can apply PRP, which is platelet-rich plasma. If you don't know what that is, basically we draw blood and then we purify it. We spin it on a centrifuge. We take out the top, the surfactant, which is liquid gold, and then we can microneedle it. I can microneedle it into the scalp to stimulate hair, but we can also put it on your skin, and then you've got that open channel, and it just slurps it on in. It's perfect for that. And then same thing with something called exosomes. Will you be able to drive after the procedure? You do not need a ride. There is strictly local anesthesia. So there is no Ativan or anything that you need. If someone's really, really nervous, that's fine. I'll prescribe that for you and you can go ahead and use it. But again, if you can handle just going to the dentist and having a couple shots, this procedure, my patients have driven themselves home. Another question about driving yourself home. how long have I been doing the procedure? So we've been doing the procedure for about a month and a half now. And I have procedures of, I didn't have the procedure on myself because I do have darker skin. So in my hands, I recommend it for Caucasian patients. So unfortunately, I know I do you guys see me injecting myself on Instagram. I do all my procedures on myself. This is one thing, darn it, that I can't do. I wish I could, because I was looking at myself in the Zoom here and I was like, oh, that would really be nice if I could remove that. Maybe one day, but right now I don't feel comfortable doing that. But the procedure has been FDA approved. It was back in 2021, and there's about 1,600 machines in the country, and they've been over 5,000 treatments performed so far this past 1 year. So they're their 1 year anniversary. As you know, I like to follow things and make sure it really works before I think about investing in them and performing them for my patients. So I've been following them for about the last year, and then, I saw those results and I said, you know what, this one's a winner. This one's working. So that's why we get it here in the Antelope Valley. Just a few in Beverly Hills, and we have it in the Antelope Valley. And let's see. We have pictures. We have before and afters for my patients. I have a patient from Bakersfield, and you can do the procedure and consult the same day. I would prefer to see you on the Zoom meeting and do a consultation ahead of time, because you may not be a candidate for the procedure. So I don't want you to kind of waste your efforts coming all the way from Bakersfield, but we can do a Zoom meeting, a DoxyMed meeting, and we can see what I think is a good if you're a good candidate for the procedure, and then we can schedule you whenever you want. If you're unable, we can FaceTime you. That's fine. I just like to see what you look like and truly make sure that this is a viable procedure for you. And we also have the specials. Don't forget. So we have the specials. We're doing raffles for Diamond Glow. So we're giving away 4 free Diamond Glows. So just everybody who registered, you don't have to do anything. We'll contact you so you can get. So what is Diamond Glow? Diamond Glow is like a super duper facial exfoliation. So we're exfoliating your skin. When that micropore is open, we can put some product on. If you feel like you're aging, we can do the TNS from Skin Medica. If you feel like you're dry, which I always feel, I'm always dry in the desert, HA5, hyaluronic acid. If you have pigmentation problems, we can put the anti-pigmentation problems. And it's a great quick procedure. It takes like 20 minutes in the office. The esthetician does that for us. And then I walk out glowing. I don't even need, makeup. You know me, I'm lazy. I don't usually do makeup. I just like to get my skin in good condition and just use a tinted moisturizer. So this makeup thing, that's unusual for Dr. Campano. I'm kind of lazy about it. So if I can just put a tinted moisturizer and go, I'm ready. And that's what I want everyone to be able to have the confidence to do that. I want your skin to look the best that you feel comfortable with doing. And a question is, being 72, do you recommend it? I think that if you are, whatever age you are, if you feel like this is a great non-surgical option for you, that's great. So most of my patients, starting late 50s for Caucasian patients, that's when they think, it's probably time for a facelift. My patients know, you come in and they'll say, I need a facelift. They might be 40 and say, I need a facelift. And I say, you don't, because a facelift lasts 10 years. And I'm going to be with you for the long term. I'm going to have to do that revision facelift when you're 50. And I don't think you need it at 50 for most patients. Some patients are an exception. It's like if you lost a lot of weight. For most patients, you don't. So if you're older, if you're 72, you might need a facelift. And I'll tell you that. But if you say, doc, I really don't want one. I don't feel comfortable. It's too expensive. My medical conditions preclude me from that. Then I'll say, okay, let's think of what other options. There's, fillers, there's lasers, there's, other things we can do. And this is one of the things in our armamentarium that we can do. But being 72 absolutely doesn't make you not a candidate, but you may need more treatments. And then how do you wash your face after the procedure? Just, simple, good, gentle face wash. I don't like soap. So we have in my Dr. Campano skincare line a gentle face wash. So you just wash it. You'll just feel almost like little pricks, little scabs. If you've had Botox, like the little scab that you get from the Botox occasionally. So a whole bunch of those, and then that just kind of falls off. Don't scrub your face, but just gently wash it. It's no problem. And then no bandages. So someone asked, do you need to put bandages on? So your skin is open, just like if you had, say, a laser ablation. You put Aquaphor on, which is an occlusive dressing, just to let the area heal. And then actually you just need the Aquaphor for the first day. After that, you can put another kind of skin protectant. If you want to use the Aquaphor in day 2 to 3, you can. It just depends on whatever, if you feel dry. And again, I love the Elastin Nectar product. I think that's a really good product to let your skin heal. Anybody have any questions? I think I went through all of those questions. Anybody else have any questions? If not, please feel free to come in for a consultation. We'll take a look at you, see what your expectations are, see if you're a candidate for this. If you are, great, then we'll talk about doing the procedure. If you're not, then fine. We'll think about other procedures that are good and that will work for you. Again, I'm not one of those doctors that's kind of like, oh, just come in for a quick lip filler or whatever. I really care about my patients, and I want you to look as comfortable as you want to look as good as you want to look. I don't want you to look like a caricature of yourself. I want to look like you. You know, you see things on Instagram and all of that, and people look strange. I don't think you should look strange. I think you should have a natural appearance, and no one should know you had anything done. They just think you look really good, like really rested. Something. What is it about her? She just looks good. And that's what I want you to, have. So hopefully you enjoyed my presentation. This is my first virtual event, so hopefully you like it. And thank you so much for the kind words in the comments section. I appreciate that. You're very kind. So have a great night, and it was great to see you.